quick video demonstrating how to use the training arm to draw blood and where you need to get before you will be cleared on the fake arm. Have all your supplies here and ready: tubes, alcohol, gauze, Band-Aid, needle holder, needle, gloves, tourniquet if I didn't say that, sharps container. Always introduce yourself to the patient. Make sure you have the right patient. So identify your patient. Ask them if they've been fasting or when is the last time they had something to eat or drink if that is required for this test. And also ask them if they're taking any blood thinners or if they've taken aspirin recently, because that will lead to prolonged bleeding at the end. Assemble your equipment. Needle always goes on the dominant side. Palpate for a vein. Okay, once you find out where you're going, take the tourniquet off, because the tourniquet cannot be on longer than 1 minute. Alcohol pad. Clean the site starting from the center and work your way out, making circles. Alcohol goes on the dominant side so that you don't accidentally grab it later. Put your gloves on. Put the tourniquet back on. You'll normally have somebody with you helping to stabilize the arm. Okay, make sure your tubes are within reach. And if you're using different colors, make sure you have them in the correct order for the order of draw. Needle. Shield goes back if it has a shield. Move away from your patient. Grab from the tip, straight off and out. Inspect your equipment, make sure there's a bevel, and make sure the bevel is facing up. Anchor the vein by pulling back with your thumb to tighten the skin, and again anchor that vein. Needle at a 15 to 30 degree angle. Okay, 15 to 30 degree angle. And with one nice smooth motion in. You'll notice I'm cradling the needle holder, and I've left it very open to get my tubes in and out. I'm also balancing my fingers on the fake arm. First tube, engage. Engage your tube. Wait for the blood to fill. Once the blood has filled, okay, this is where you take your thumb and you push and you pull with your fingers. Get it out. Grab your next tube. Bunny ears. Push. Last tube, so I'm going for the tourniquet. You're keeping your eye on the needle the entire time. You're having to feel around for everything and look using your peripheral vision. Thumb, push, pull, gauze. Okay. And with the gauze, you want to put it lightly against the skin. Don't put any pressure until the needle's out. So lightly, needle out, pressure. Sharps. This is where you dispose of your needle in your sharps container. While we're on the training arm, I don't like to waste supplies, so I am safely scooping up the cap and recapping the needle, only because we're on the training arm. For the actual patient, you would have pressure, you would apply your Band-Aid, and now you would invert your tubes 8 to 10 times. Label your tubes with the patient's name and date of birth and today's date. And your technique is complete.